reproductive system. And the female reproductive system is responsible for producing children, reproduction. Have you heard of reproduction before?
Yes.
Perfect. And the female reproductive system, does anyone know what it includes? Can you guys see here? Yes. Okay. Yes, that's the female reproductive organ. This here, fallopian tubes. Yes. Okay. So the ovaries, they are on either side of the lower abdomen that produce female hormones and release an egg cell once a month. And then we have the vagina. It is the muscular tube from the outside of the body to the opening of your uterus. You can see here. Then to the opening of your uterus.
So this is it.
Okay.
Look at it. So you see it? It's like a tube. The vagina is inside. It's where?
Inside.
It's inside.
Yes. And then you pass from your uterus,
Yes.
from your uterus up here. And it comes out from there. Is everything okay back there? What's wrong? Please don't fall. Then there's the fallopian tube. It's the pair of tubes that is connecting to the ovaries. I wish I could draw. Travel from your ovaries down to your uterus. And then we have your cervix. And the cervix is the opening to your uterus. But when she's done, then you get an idea of what I'm talking about. So I'm going to keep talking. Am I allowed to keep talking? Yes. Are we all listening? Yes. Are we all learning something?
Yes.
Now, after we talk about the female reproductive system and the anatomy, we talk about puberty, because we cannot talk about your reproductive system without talking about the changes that you are going through. Does anyone know what puberty is?
Puberty is the transition from childhood to adulthood.
Good job. I wish I would give you candy. You already have candy. You want another one?
She's getting another one. Give it to her. Some people don't want to talk.
All right. What she said it beautifully. So puberty is a time in your life when you grow and change, both physically and emotionally, to become an adult. It usually starts between the ages of 9 and 14. So during puberty, your body goes through different stages and changes over several years. It's not very fast. It's a very slow and steady race. Some changes may happen earlier or later because it is different in people. We have some people that will develop faster than others, and that is completely normal. It is completely normal. But knowing what to expect can make it less overwhelming for you, because sometimes when you are going through changes, you tend to compare with your friends, and you think what you are going through is not normal because other people are not going through it, or you are not seeing the same changes in them. Believe me, it's normal. Everyone is different. We are all built differently. We are all created differently. So we all go through changes in life differently. I hope you understand that.
Yes.
Perfect. So it is helpful for you to talk about what you are going through with trusted adults. Adults that you trust in your life. Most importantly, your parents. who can give you advice because they have also gone through puberty, believe it or not. Your mother has gone through puberty. Okay? So it's normal. Alright? Feel comfortable to talk to a trusted adult in your life. Okay? If you have an older sister, you can communicate with her because she has gone through puberty. So she'll be able to understand. Don't think you have to go through it alone. Okay? Are we listening?
Yes.
Thank you. So, as you go through puberty, there are some specific changes that will happen to your body. For the females, your breast will develop and get bigger. Your hips will get wider. And your body may become more curvy. And then you start getting your period. I hope you know what I'm talking about.
Yes.
Perfect. So,
Can you hear her? Those are the best.
lovely cool. Do you have that? Yes. So don't be shy.
I know some of them are not talking. Maybe they want to say no.
No, don't be shy.
Those who are not talking, do you have that?
You don't have that. You don't have a trusted adult of the same sex, like a woman. I'm a female teacher that you feel comfortable talking to. Or your older sister. You do. Perfect. Feel comfortable to talk to them about how you are feeling, especially emotionally and mentally. It's very, very important because you need the support. Like I said, you don't have to go through it alone. You don't have to go through it alone. I hope you understand what I'm saying. You're not alone. You can see everyone that's in this room is going through the same thing you're going through. Is that so? So you should feel comfortable. Talking amongst your friends too, right? It gives you the confidence. Why would you want to keep it to yourself? Why do you want to keep it to yourself? Is it if it's bothering you so much? I don't recommend keeping it to yourself. If it is bothering you so much, I don't recommend keeping it to yourself. Like I said, maybe you don't feel comfortable talking to that trusted adult, but you can talk to your friends. Sometimes when we talk to our colleagues and our friends, it releases the stress and the tension on us. I hope you have trusted friends. Friends you can trust. Friends because they probably they have limited knowledge, and that's fine. When I talk about you talking to your friends, it's a sense of camaraderie, like you are sharing the same problems that both of you share. So I'm going to delve into teenage pregnancy. So, if you are sexually active, okay.
There's no sense in maybe she keeps it to herself. Maybe you couldn't say, but if she tells another person and then they find a solution to help you, to some extent she has told you that is not betrayal. Or what do you think?
Yes.
That's a very good question. Sorry. So now we're gonna delve into teenage pregnancy. As I was saying, when you are going through puberty and you are developing your hormones and you are having this intense feelings and emotions, it can lead to certain behaviors, which can lead to teenage pregnancy. So, if you are sexually active, there is a risk that you could get pregnant as a female. And the risk of engaging in unprotected sex as an adolescent can lead to teenage pregnancy. And as two of my wonderful sisters have said about teenage pregnancies, when an adolescent gets pregnant. And I'm going to talk about what happens or what causes pregnancy or what can create pregnancy. It's when a female has sex with a male I don't know, have you guys talked about the reproductive system?
Yes.
Vagina, there's a chance that she could become pregnant. And I want to also emphasize, even if the male pulls out his penis before ejaculating, there could still be some leftover sperm in the fluid that comes out before ejaculation that can cause pregnancy.
A lot of teenage pregnancy occurs because of what she just said. A lot of the young girls think that once they will say Russian, they will say, oh, I didn't enter, nothing. But what we are saying is that even the small water Russian, that sperm can be inside and you can be pregnant. And so when you get pregnant, the man will say, oh, it's no me. So that is what she's trying to say. Please, do you understand?
Yes.
Okay. And it is also important to know that pregnancy can also happen even if there is no vaginal or penetrative sex. So if a male person ejaculates very close to the vagina, or if an erect penis touches the vagina, as she said, brushes, there is still a small chance of pregnancy. Although it's rare, but it's not impossible. So don't think you are special. Don't think just this one time. Believe me, it only takes one time, once, to become pregnant.
Yeah, so in my
As a
hospital,
teenager.
I've seen children who are 13 years, 12 years get pregnant. What is she going to do with the baby? And what she people I'm saying? People are over 30, I'm saying. You can imagine that 12 years with baby.
Yes. So that's a beautiful segue into talking about the risks and the effects of teenage pregnancy. Can anyone think of any effects or risk of teenage pregnancy? Do you have any idea?
Pregnant. She may die during when she's delivering the baby.
Absolutely. Good job. She said that when a teenager gets pregnant, she may die during delivery.
She may die during delivery. Yeah, because it's not very mature. That's the question.
Who wanted to say something? Absolutely.
Drop out from school.
Yes. That is my number one risk and effect of teenage pregnancy. Interrupted education. If you get pregnant as an adolescent while you are in school, your education will be interrupted as you have to drop out of school to take care of the baby. Absolutely.
The painful part.
Yes.
And please, the dropouts, let me talk about them. You know, I don't know who she is, but then there's one girl that anytime I am walking and then I see her, because I knew her, she lives in the area, okay? And then she's pregnant, I think 13 years or 14 years. Now she's carrying the baby at the back like I'm doing, and then she's selling, is it roasted corn or something? And she has dropped out from school. And her teachers are saying she was the most intelligent girl in the class. Is it not sad? It is very sad. So please, we don't want anybody to drop out of school.
Exactly, as she said. So with your education cut short, a teenage mother may lack job skills, making it hard for her to keep or find a job. As she said, she started selling roasted corn. A teenage mother may become financially dependent on her family. That is only if her family accepts her.
What you say is that you don't have money. At 13 years, do you have any work? No. Do you know how to sew? No. Hairdresser? No work. So you just be there. If somebody doesn't give you one CD, you don't even have that. And it is not a good thing, right? To be rich. Don't you want to be rich?
effects of teenage pregnancy is health risk. There are some health risks that are associated with teenage pregnancy, to include obstetric fistula. Because you are a teenager and your body hasn't fully developed, and now you are pregnant, during labor, it might take longer than the average that it should take a fully developed woman to go through labor. And because of that, it causes something called obstetric fistula.
Okay, let me explain that. So what she's saying is that you see your pelvis, everybody touch this place. So as you are growing as a woman, it's growing so that one day when you go into labor, Felicia, are you serious? Sit well. And look here. Okay, so as you are growing, your pelvis has to grow. And then it will expand. Then if you are going to give birth, you can go and give birth. By your 13 years, 14 years, 15 years, it has not developed well. So when you go into labor, the labor, instead of it taking a shorter time, maybe 12 hours or 10 hours, yours will be like 3 days. And if you're not careful, by the time you realize, there will be a hole between your vagina and your anus. So what happens is that sometimes the person is not urinating, but urine will be coming out from the body. Do you understand? So sometimes you see that the woman will get feces. So the woman will be there and then be leaking urine or feces, and then her body begins to smell. Will the boys come again? So you don't want that, right? Yes, so you need to be careful about it. So that is the fifth.
Yes, you have to worry about preeclampsia, which is basically your placenta not developing properly due to problems with your blood vessels. Again, because your body has not fully developed. You are still developing, you are still growing, you are still an adolescent, you are still a teenager. You have to worry about anemia, low blood cells in your body, lack of iron.
The problems are many.
And many more. Another risk is maternal mortality or infant mortality. And according to the World Health Organization,
maternal mortality simply means that women who go to give birth and then they lose their life. Do you understand? Yes. Have you heard some of that? Yes. Yes. We are praying that in Ghana and Africa it will stop. And one of the reasons is also teenage pregnancy. Because if they are teenage, some of them they are even afraid to go to antenatal. They are afraid to say I'm pregnant. So she leaves the pregnancy, if something is doing, she will not say. By the time you realize she's gone. Okay, so let's not get pregnant.
According to the World Health Organization, adolescent mothers that are aged 10 to 19, they face a higher risk of eclampsia and other infections than women who are aged 20 to 24 years. And the babies of these adolescent mothers face higher risk of low birth weight, meaning you give birth to a premature baby, a baby that is not the average weight that they are supposed to be. Again, I always bring this back because your body has not fully developed. So your body is not fully equipped to carry your pregnancy to 9 months. You have to worry about the stress that you are going through. You are an adolescent. You dropped out of school. You don't have work. You don't have money. You are depending on other people. So you are not getting to take care of yourself in general with the appropriate nutrition that you need for your baby to grow healthily and for you to deliver your baby safely. You have to be very careful. These are the risks and the effects of teenage pregnancy. And I already talked about premature birth. There is also stillbirth. There is a study that was conducted in Ghana here, I think last year, 2022, and it showed that the risk of having stillbirth, so stillbirth is you deliver the baby, but the baby is dead, is more than 40% higher in adolescent mothers as compared to the older, mature mothers. I hope you understand what I'm saying. Are we still here? So can anyone tell me anything about the effects and risks of teenage pregnancy that I said? Anyone? I talked about 5 of them.
What did you hear?
What did you hear? What did we talk about? Please engage me. So I don't feel like I'm talking to myself. Oh, it's okay, don't be shy. Those are the health risks, yes. That leads to obstetric fistula, as midwife Sally told us what they are. Anything else? Yes, I did before. You already said. Please tell me. Did you already? Yes. By your parents.